Before I start, a word of warning. This video will deal pretty heavily with eye stuff. Poking, prodding, operating on eyes, and I know that creeps some people out. So if you'd like to bail, that's cool. Now's your chance. Right, now that we've lost the wusses, let's talk about cataracts. What are they? Why did we start operating on them? And what happens when you remove them? Cataracts appear in the lens of the eye, the clear, crystalline structure that sits just behind the pupil. And a cataract causes your lens to become less transparent, giving you a misty or blurred vision. Now, many things can cause this clouding over. The lens is made of a precise structure of water and proteins, and as you get older, these proteins can start to clump together, blocking some light from entering the eye and also reducing the sharpness of the image that you see. As they develop, cataracts can also affect the colour that makes it through. It gives your vision a slight brownish tint. Most cataracts are related to aging in this way, even though we still don't fully understand the mechanisms that make those proteins clump up. However, we do know that clumping of proteins can also occur after eye surgery or injury as a consequence of certain diseases like diabetes or even after exposure to radiation. Also, some people have a genetic predisposition to develop cataracts, and so they develop them while they're young. In those cases, sometimes surgery is the only answer. And I'll be showing you a video in a bit of a young boy having this operation. Cataract surgery is actually one of the oldest surgeries that we know about. We think that the ancient Egyptians knew about cataracts and treated the condition using a couching technique, basically using thin bronze needles to push the cloudy lens back into the watery centre of the eye. Now, this nasty sounding technique did let light back into the eye, so you got some vision back, but good luck being able to focus on any hieroglyphs again. Couching remained popular for a long time, though some Persian healers did develop a technique where they'd use a hollow needle, and assistants with extraordinary lung capacity would then suck the lens out. I did warn you that this was going to be gross. The first modern surgical extraction was performed in Paris in the 1740s, but all of these initial surgeries were restricted to ripe lenses, ones that had hardened so much that they could easily be pushed in or removed in one piece. Today's cataract surgery is more accurate. We can now remove the lens while leaving many of the structures of the eye intact, including the lens capsule, and we can swap that removed lens with a plastic replacement. Now, this sort of surgery is one of the most common surgical procedures in the world. Here in the UK, more than 300,000 are carried out every year. Right, okay. We have some footage from the BBC Science series Forces of Nature now, showing a small incision cataract surgery on 7-year-old Majidul, whose eyes were so clouded due to cataracts that he had been effectively blind since birth. Now again, this footage is not for the faint of heart. Check out the cataract, that's the white disc in the middle there. Majidul has been put to sleep, although you can also have this procedure using just a local anaesthetic. The surgical team needs to hold the eye in place, and they'll also give the patient eye drops to widen or dilate the pupil. In this case, they've also added dye to help them see the lens capsule. Then the surgeons reach in and gently remove the lens, being sure not to leave any bits behind. Actually, a more common way to get rid of the lens is phacoemulsification. An ultrasonic probe uses sound waves to break up the lens into tiny pieces, which are then sucked out, a bit like the Persians with their straws. However the lens comes out, an artificial lens will be inserted into the lens capsule to replace it. Then it's all over, bar the cleaning up, and sometimes a couple of stitches in the cornea. They'll bandage the eye, and that's that. Majidul can see again, a seemingly simple operation that has changed a boy's life. And the whole procedure takes 30 to 45 minutes. And as gross as that experience was, I'm pretty sure it's more horrifying not to be able to trust your own eyes. Now, that amazing footage was taken from BBC Science series Forces of Nature. If you'd like to find out more, you can watch some other behind the scenes clips from the series by clicking here, or check out the links in the description to find out more.